Now this is an ultrasound study of a 38 years old young man with the complaint of KUB. He presented to me for ultrasound last week, had a procedure performed in which a stent has been placed, and we can see that this is the urinary bladder, and this linear structure that you are seeing within the lumen of the urinary bladder is the stent which is patent in transverse section. See it again. Going to magnify it for you. Now this linear structure is in fact the stent that has been placed for the removal of calculi from the right kidney. And this is the stent. In this scanning plan, pathology. With otherwise, if you see that the urinary bladder is normal, with no calculus, walls are thin, and no debris is seen in it. So the urinary bladder itself is so far having only a stent placed with no other finding. Now let's move to the right kidney and see what is the situation over there. Now you see that this is the longitudinal section of the right kidney, and what's seen is that there are three calculi, 1, 2, and this is the third one. This is the upper pole of the right kidney, and in total, because they are almost matted together, the measurement of the calculi is approximately 2.34 centimeters, and this is the upper pole, and these are the minimally dilated lower pole calyces. If you see the parenchyma, the medulla is not seen, the pyramids are not visualized, the echogenicity of the cortex is normal though, and otherwise central sinus echo complex is muffled. These are additional findings that are seen in this case. So it does show muffling of the central sinus echo complex, and there are a few tiny concretions also seen in the lower pole. This is a small concretion. In the lower pole, it is minimally dilated lower pole calyx. These are the calculi that are gathered together in the upper pole calyces. Muffling of the corticomedullary differentiation with almost preserved cortical thickness and intact parenchymal echogenicity. Another thing to see in this case is that there is a calculus seen in the non-dilated proximal ureter. Now this is the right kidney that we're seeing a longitudinal section. This tube-like structure, hypochoic tubular structure, is the proximal ureter, and here is the calculus giving posterior shadow. This is the calculus in the proximal ureter, about approximately 5.1 centimeter from the region of the pelvis, and the calculus measures 10 millimeters, is within the non-dilated proximal ureter. Now this tube-like structure is the proximal ureter, and these are the same calculi I have shown you initially. So there is a calculus in the non-dilated proximal ureter as well. Now what is the status of the left kidney? If we this is the right kidney, and you see now I am going to show you the left kidney. This is the left kidney. You can see that there are multiple calculi seen from the lower to mid region of the calyces, collecting system. This is calculus, this is a calculus, this is a calculus, this is the posterior shadow that you are seeing posterior to it. However, in this kidney you will see calculi in the now this is the upper pole of the left kidney. You can see a tiny concretion in it, and you can see a tiny concretion in the mid calyces, in the mid region calyces. This is the collecting system. Minimal hydronephrosis or dilation of the calyces seen. The parenchymal thickness is intact, whereas the corticomedullary differentiation is muffled. The urea and creatinine both are mildly raised in this patient. The reason is that we do not see medulla in this region. There is muffling of the medulla, and all of this up to here is the parenchyma. The upper part is the cortex. No medullary pyramids are seen, and there is muffling of the corticomedullary differentiation. And there are multiple calculi seen in all the calyces from upper to lower pole. So this is our case of the day. Thank you very much. Now this is the post-maturation. It's important to see the post-maturation volume in all patients with kidney urinary bladder disease. Now you see this is the stent. This is the seminal vesicle. This is the transverse section of the urinary bladder. This is the longitudinal section of the urinary bladder. And now I am going to calculate the approximate volume of the post-maturation. How much of the urine is remaining behind. More than 50 will be taken as not normal. So in this case, the urinary bladder is in post-maturation. The urinary bladder contains a urine volume of 211 ml. More than 50 is considered abnormal. Now, so the post-maturation or post-void residual volume is raised even after the procedure, the surgical procedure or the interventional technique that has been used, that of placing the stent in the urinary bladder. Thank you very much.